Right. Uh, Dr. Atul took us into a very exotic world where we felt that we should not only take one of the drugs, but we should take drugs from every class that he has mentioned. Right? So from there, let me bring it to a rapid detox, which is crashing into the world that we often practice, which is to get our bread and butter, we need to assess, we need to diagnose, and we need to treat. So let us start with the not so fun part of our bread and butter. Assessment, diagnosis, and substance use disorder. I need not teach you much about this. You practice in your day-to-day life. The assessment, what we follow in psychiatric disorders is not much different than what we should do for a substance use disorder. There are certain caveats which we need to see. I'll invoke Rudyard Kipling in this, where he said that we require this 6 honest men, and let us see how we apply for assessment. Often what happens is, when we talk of assessment, it's a process where we all know that the therapist or the service provider is able to understand the patient or the client and his situation. It helps us to define the problem and arrive at possible solutions for the patient or for the problem that the patient is facing. The most important part of assessment is that it's the first point of contact between the service provider and the patient, and much of what will happen later depends upon how this first contact goes and how do you manage to convince him to continue the treatment with you. Right? So it becomes a very deciding factor in continuity of the treatment process. Often when we talk of assessment, we think that whenever we talk to our residents, they come with beautiful workups, 6-7 pages, and they come to us. Most of the time it's only to the possibility of establishing or not establishing dependence. But assessment is not just about diagnosis. There are multiple benefits of carrying out an assessment. So assessment helps us to screen. It helps us to screen whether the patient can be treated here, can be managed here, should we need to send him somewhere else. It helps of course in diagnosis. It helps us also in planning treatment. What are the next steps, immediate steps that I should take? What are the long-term steps that I need to take while I am assessing? It helps us to understand what are the referrals required, not just treatment with me, but with my colleague from medicine or from other professionals. Most importantly, assessment also helps us to enhance motivation. It also helps us to increase the treatment seeking and continuity of treatment seeking by the patient. And of course, it helps us in establishing a rapport, a therapeutic working relationship with the patient per se. It's not a one-time phenomenon. It's not as if you assess, you diagnose, and then your assessment is out. At various stages, in the initial phase, the focus of the assessment is more often to define the problem, formulate a treatment, and enhance motivation. So this is the first thing that we do in the initial phase of the assessment. As your treatment continues, in the middle phase, what we see is the assessment has other benefits or other reasons why we do. So here it is to monitor the progress, to identify what are the barriers to treatment, what are the facilitating factors for treatment, and of course here also we need to continue to enhance this motivation. And in the last phase or the later phase, what we need to see is what is the right time to terminate treatment, what is the time when the patient can be on his own without being in contact with the therapist or the treatment provider, and of course to plan post-treatment management, what should be done after he has continued or he has completed treatment from the service provider. There are various ways that we know of assessing. The first being the clinical. Right? So clinically we know we conduct interviews with the patient, their family members, and we conduct examination. The way in which we do clinical history taking and examination of substance use disorder is this. A quick recap of what we do is, we talk about or we inquire about every substance used till date. It's not just the substance for which he has come to you for treatment, but also we need to talk about other drugs. And what we talk about is the age of initiation, circumstance of initiation, what prompted him to start, and what prompted him to continue the use of that particular drug. The frequency of use, how frequently does he use, once in a month, once in a while, daily, weekly. So that we need to see. We need to see what is the usual route that he is using, what is the usual quantity and time that he has taken, and what is the time since the last dose that he has consumed. The effect of substance, acute effect of the substance, and the chronic effect of substance that we need to see. We need to assess for every substance also the complication associated with that use, be it physical, psychological, familial, social, occupational, so on and so forth, right? We also need to assess, apart from these two factors, also what are the high-risk behaviors associated with substance use. And it's not just high-risk sexual behavior or injecting behavior in case of people who inject drugs, but also other issues like whether he has been driving under the influence of substances, whether there has been violence, brawls because of use of substances, unprotected sexual intercourse that he has done. Also, we need to assess any previous attempts to quit and previous attempts to seek treatment and what happened as the outcome of the treatment. Why did he go back to using drugs? How long did he continue treatment? What were the modalities? So this will help us to understand what the situation the patient is in currently. We also have structured instruments to assess, and these are set of structured questions that we commonly use. There are validated and reliable instruments that are available for different populations for different settings. So broadly, there are screening instruments which may not be of much use to us psychiatrists, but for people who are working in general clinics, there it will be very much useful as a quick assessment, say instruments such as CAGE or audit or assist or drug abuse screening test. So these are available with us for a quick screening and seeing whether he requires help, intensive help, or should I just give him some basic education and send him out. There are instruments which help us to score the withdrawals so as to objectify the withdrawals and objectify our treatment. So the most commonly ones used are, for example, alcohol and opiates, which are the focus of today's lecture. So we have the Clinical Institute Withdrawal Assessment of Alcohol. It's available easily online, free. There is no copyright issue there. So it's a revised scale, SIVA-R, which is there. We also have subjective and objective opioid withdrawal scales. These also are free. They do not have any copyright problems, so we can freely use them, and it helps us to objectify the withdrawals that are there, right? And we also have other instruments, like for example for severity, the common which is used is addiction severity index. We don't use it in our routine clinical day-to-day practice, but for people who are conducting research, who need to find out the effectiveness of treatment, of course ASI is something which is used very commonly. This instrument also is available, which is adapted to Indian settings. Hindi version is available, so we have the norms also for that. Motivation assessment by instrument called as Readiness to Change questionnaire, which is being used since long time, so that is available. Brief treatment outcome measures to measure the success of a treatment, that also is available. So we have a number of structured instruments that are available, which can help us objectively assess, quantify, and see the progress in our patients. The third is the role of laboratory investigations. Often in psychiatry, mental health, we don't have many investigations which will help us. Here too, there are broadly two kinds of laboratory investigation that we need to do. We can do assessments for seeing whether there is a negative effect of the body, of the substance on the body. So that is something which we can see. We also can do drug screening, but what is important in drug screening is that it assesses the presence of drugs in the body. And the type of screening that you do, it will determine the type of drugs that you are screening for. That will determine how much is the last time limit that you can see. For example, you can detect some drugs only for last so many hours. Some drugs, for example, you can see over the last 3-4 days. For example, opioids, you can see over the last 72 hours the patient has consumed opioids or not. Cannabis, it's there for a longer period of time. So depends upon what drugs you are screening. How do we commonly screen? We use samples of urine, blood, saliva, sweat, hair. Though urine is the most common body fluid which is used for conducting laboratory investigation. There are various methods, thin liquid chromatography, GHC, GCMS. There are various investigations that are used. What is also important is currently we have a number of cassette tests, like we have for assessment of or for screening of HIV, hepatitis. So we have similarly cassette tests for a number of different drugs. Like for example, for assessing morphine, you just take urine sample, use a cassette test, and within 15-20 minutes you'll be able to know whether the person has used heroin or any substance whose metabolite is morphine immediately within 15-20 minutes or maximum half an hour. These cassette tests are available and it's not very costly in the sense that one cassette will cost you somewhere around 75 to 80 rupees or max 100 rupees. So that is something which we can use. But what is important here is that will just tell you over the last certain number of hours or days whether the patient has consumed that particular drug. It will not help you to diagnose dependence, abuse, or the problems that the substance has caused to the patient. Right? It can also be false positives. That is something. There are some chemicals which can interact with the test result. So that is something which you need to be careful about. It is mainly useful for monitoring abstinence. So if the patient is on treatment, we can see whether he continues to be abstinent while he is taking treatment from us. It is helpful in monitoring treatment adherence. For example, when we provide opioid substitution treatment or agonist maintenance treatment, it's very useful to see whether the patient continues to take the treatment that we are offering to him. It also has forensic utility, legal cases where we require such screening laboratory investigations to tell whether the patient has consumed this particular drug or not. So that was about laboratory screening.